Good evening, everybody, and welcome to our Facebook Live about our new patient access system in Mid Sussex called Rapid Health. I'm really excited to be joined by Dr. Sharon Pruden and Dr. Ellie Flatman this evening. Ellie's going to run through a short presentation about the new system and how it will work. And then once we've been through that and a bit of a demonstration, we'll then open up to questions in the comments in the chat. So if you're watching on Facebook or YouTube, please put your comments or questions in the chat and we will try and answer as many as we can within the hour that we're on. If you're joining us later than the live start, you can go back to the beginning, or you can watch again. If you haven't got time to watch all of this at this point, it's recorded and it's then left on the Facebook page and the YouTube page for you to watch at a time that's convenient to you. So don't panic if you've got to go and make the tea or go out somewhere tonight and you're going to miss it. It'll still be there. Okay, I'm going to hand over to Ellie and do the presentation now.
So thank you to everyone for joining us. We want to introduce our new triage system, and we want to acknowledge that we are aware that there has been significant problems with access to the practice prior to this, and the aim is that the new Rapid Health triage system will improve that access for you as patients and make the journey significantly better, and improve the access for the patients. So the platform we're going to be using for our triage is called Rapid Health. You probably will have had some text and information sent out about this, or you may have seen something on our website. It's a questionnaire-based web system which you'll access via the website, which I'll show you how to do that shortly, and it will enable GP appointments and allied healthcare appointments such as our paramedics and nurse practitioners to be booked via this. It's currently available to over 16s only. We're hoping that shortly under 16s will also be able to access the practice this way. For the under 16s, you will still need to access the practice via the receptionist, who will take some details. The bonus of this is most patients should be offered an appointment to book directly at the end of the questionnaire. So there's no need for you to call the practice, and there is no need for the practice to call you back to book you in. Some patients will require a call back for the practice for various different reasons, but most patients should be able to access an appointment booked directly. So the Rapid Health platform has several options. This is what you will see when you access it via the website, and it's mainly the medical request function we're going to discuss today. The admin request function I will mention shortly, but is very similar to the options that are available currently, which some of you may have used for fit notes or queries about tests, for example. So the opening hours for Rapid Health are going to be Monday to Thursday, 6 a.m. to 5 p.m. and Friday, 6 till 4. If you're unable to access the form via the internet, then the receptionists will be able to talk through the form and answer the questions with you, which will enable you to access the same appointment booking system as everyone else. And once that's done, the system determines how urgent your problem is, and will offer an appropriate appointment with the right person. So whether it needs to be that day or it can wait for a routine appointment slot. So just the options available on the admin function are all there. I'm not going to go through them. You can see them there. They would be sent through to the practice, and you would be responded to with various different options from that. So we're going to have a go. We're going to walk through the form and show you what it looks like, and just to see where you would be able to access it. This is our practice website, the new practice website that some people hopefully have had a look at now. you'll see where it says at the top there, contact us online. And if you click on submit a new request, you will be taken to the Rapid Health page, which will enable you to submit your request. So I'm going to go into the Rapid Health portal now and show you what the requests would look like. So now hopefully you should be able to see my screen, which would be what is shown to you when you go on. So you would need to be using the medical request function for what we're talking about today. And you would select there. The first screen is just screening for any serious conditions that we would be suggesting that you go to hospital or call 999 for. The next option is allowing you to put in your symptoms. So you type into here what your symptoms are. So for example, I'll just do a couple of options. We could do, let's do back pain, search, and you'll see it comes up with various options and you can select which of those would be most appropriate to you. I'll just do another couple of options. So you can see these come up with other options, and I'll just do the last one, which we'll work through. So if we go for cough, we will go through the breathing problems option, and you click on here, which gives you a bit more information about what conditions are covered within there. And if that's appropriate, then you can move forward. Now, this is where you input your patient details. We're using a dummy patient today, hopefully. Uh-oh. Do I have to do it before it's shared, Lois? Because it won't let me.
Is it just stuck, Ellie?
Just stuck, yeah.
I would close out of it and go back in, reshare again and see if that helps.
Won't let me do anything.
Let's see if I can remove it. There we go. I'm going to remove you, Ellie, because I think you've frozen, and then we'll see if we can get you back. Are you there?
I am here. Can you hear me?
It's on black. You're just a black screen.
Okay.
Have you closed it down and reshare it again?
I can't do anything.
Okay. Shall I, do you want me to share screen with the Rapid Health and go through it?
Yeah, I might have to shut down the computer and rejoin.
Okay, that's fine. No problem. Best laid plans. Okay, let me share screen and get the present. Here we go. So I'll just quickly go through the different pages to get where we were before. As Ellie was saying, this is if you need to call 999. We'll search on an option. If I choose back pain and search, and you can see underneath that the different options, I'll try and make it big on screen so everyone can see, are underneath. You can click on show and you can see the different information underneath that will provide some clarity on the different types of conditions you might be searching on to try and find the right one. If I click on select, it'll take me through to this screen, which we're going to put a dummy patient in. I'm going to put Minnie Mouse in to do this. So when you were filling it out yourself, you will put your own date of birth and your gender and your name. And your name has to be the same as it is on your medical record. So for instance, if your name known as Johnny, but your name's Jonathan on your medical record, you need to make sure you put Jonathan in as you're searching, because what it's going to do is going to I'm just going to think of an email address. It's going to look for you on the system. Now it's going to ask you for an email address because that is where actually it sends a confirmation email to you. If you don't use your online, or one of your relatives don't use email, if they're contacting the practice over the phone and the receptionist is filling it out over the phone, they will then they will then put in a dummy practice email address so they can carry on to use the system. So then at this point, it's going to ask you for the best phone number to contact you on. So that is the contact number ideally would be if you're going to be available that day if we needed to contact you for some more information, or it was going through to the duty doctor to review about an appointment rather than allowing you to auto book an appointment. If I click on next, it's going to take me through to this page, which basically is saying, do I understand that anything I enter in the next questions and form will be saved to my medical record? So I'm going to click yes, I understand that, and move on. Now, these questions are all going to be about back pain because that is the option I selected at the top. And it'll take me through a few questions to try and hone in on what it is I am contacting us about, and also what would be the most appropriate appointment for you. So it's going to ask you a few questions. The next ones are all answered by either tick boxes or by drop-down lists. So it's a case of scanning down and understanding and clicking all the ones that are appropriate to you. So if I click on it's affecting my legs and my upper back, and it's going to ask me about some more symptoms, that have I got any of these? And I'm going to say, no, I don't have any of those. And I don't think I've broken a bone. Then it's going to ask me sort of what sort of pain do I have? So I'm going to select moderate pain. And then as you see, I've answered questions. It's then prompting for other sort of answers that might be related to my pain. So I'll choose it's shooting and throbbing. And when did it start? I'm going to say suddenly and click on next. Now, all the information on screen and the answers are a reading age of 7 years and above. So it's really trying to make it as easy as possible for people to understand. Again, if you've got relatives or yourself that are unable to use the online form, it'll be our team taking you through this form over the phone. So I'm going to say I'm not able to, well, missed a question. Did your pain start because of injury? I don't know why my pain started. Not able to put weight on. And then I think answer here, I'm going to click, I've got a bit of redness and swelling. I don't think I've had enough, well, I definitely know how to have an operation, and just clicking on the different things about flexibility of joint and pain and stiffness. When I click next here, it's going to take me to the same questions that are on the end of every single condition, some standard questions to try and rule out any sort of complexities in your health that might contribute to how soon you need an appointment. If, for instance, I clicked on answering those questions before on any sort of red flag type symptoms that might indicate that I need A&E or may need A&E, when you finish the questionnaire, it would pop up with two options. One saying, we think you may need to go to A&E, and then offering you, if you go to A&E, please let us know, click this button that was saved to your record to say that you'd accepted and gone to A&E. The other option lets you carry on, but it asks you why you think you're safe to carry on. It could be that it's a long-term condition that you've got, that you know it's a flare-up and you know you're safe to wait for a GP appointment. Or it could be that you feel well enough and actually it's just been a bit risk-averse and you feel comfortable actually to wait. It does safety net and say if you carry on that option, we will submit the request. It will always go straight to a GP to review. You won't be allowed to book an appointment because obviously you've shown some red flag symptoms. So I'm going to say I've got none of these here, none of these different types of conditions or things that are applicable to sort of high risk patients. I click none and I'm going to click next. Oh, I've missed a question. Missed a question. Oh, it's going to ask me, they always ask you what your temperature is. I don't know. I don't have a thermometer, but some people will, and it is helpful if you can capture that if you do know it, if you feel that you've got a temperature. I click on next. And at this point, it's going to look to book some appointments. It won't find any because we're not live on the system yet. So I'm going to stop sharing screen and bring Sharon in. And that's really how the system kind of works. Once you get to that booking screen, it will show you options and dates for booking. And within that, you can filter by where. So if you click on where, it'll pop up and it'll show you the 4 different practice sites. So you can filter the appointments by the different practice locations. For instance, if you're in Parkview, which is further away from the East Grinstead sites, you may want to just search on Parkview, or if you're at Crawley Down, you may want to search on Crawley Down. If you live somewhere else, you can search on the other locations and visit those. That's absolutely fine. But equally, if you're not bothered, you can search on all locations and travel if that's what you wish. But you can filter by where. You can also filter by who. So you can actually click on who and show out of those appointments that are available, who are they with. So if you had a particular GP that you were talking to or concerned about an ongoing issue, you could actually pick that particular GP if they are available on that day. Then underneath, it'll show you the dates. You click on the date and then it'll show you the times. If it's something the system thinks you could have a face-to-face or a telephone appointment, it will show you both those options, and on the time of the appointment slot, it will show a little telephone symbol to show that that's a phone appointment. With this change, we are moving to offer more face-to-face appointments than we ever have in a long time, so rather than telephone, because we have found that actually a lot of the time it's best if we just see you straight away face-to-face rather than phoning you and then bringing you in. So this change is really trying to maximise the number of appointments that we can offer. So in reducing the amount of triage time our GPs are doing by using this auto book triage through Rapid Health, and then also by reducing the amount of telephone triage we're doing and just seeing you face to face straight away and giving you that option, is another way we're trying to maximise the appointments. Once you've booked your appointment online, or the receptionist's done it for you over the phone, if you have used an email address that is valid to you, you will receive a confirmation email. And within that confirmation email, there'll be the option it'll show you the information about your appointment, the date, the time, location, or if it's a telephone appointment. And then there's an option to either reschedule or cancel. So if you find you no longer need that appointment, you can cancel it that way through the email. And if you've done all the thing, you've booked it, and then you've realised, oh my goodness, I've got the dentist at the same time, you can click on reschedule and it will take you straight back to the booking end of the system. It won't ask all the questions again. It'll just take you back to where you can choose and filter appointments that you would be able to book. If, of course, you were doing it over the phone and the receptionists have done that, and you're comfortable using the phone more than you're not able to access online, then you would still just phone us to be able to change that appointment. Sharon, have I missed anything out?
I don't think so. I've had a message from Ellie. Could you possibly resend her the link?
I will do that now.
Cannot join from the previous link. It says it's been used.
That's fine. I should do that now. Yeah. Okay. So we haven't got any questions in the chat, but I think there's a couple of questions I can think of that might be valid. So some people might have live in the same household and have a shared PC or email address, and they might be worried about how that's going to work. Well, it works absolutely fine. You can use it in the same way if you're happy for your confirmation email to go to the same email address. And the same thing with filling out the form online. You both can do the same piece. So that's absolutely fine for you to do that. I've sent Ellie the link. Hopefully she'll get that and be able to rejoin us. The other common question that we have is, I already use Patient Access or any or Connect or repeat prescriptions. Will that be affected by this change? And no, and we'd really encourage you, if you use the NHS app or Patient Access or Voice Connect, that's the best way you can audio repeat prescriptions. It's the quickest way for you, and actually at our end when it comes through, here's Ellie coming back. It's the quick way for us to be able to process your prescription. Welcome back, Ellie. I just want to take you through this. Okay. Oh, the background. Hi, Ellie. You okay?
Sorry. Yes, I was watching live, but yeah, I couldn't get back. Sorry, I'm back now.
It's fine. That's brilliant. Glad to have you back. So I've just answered a couple of the questions that I think that people might, because we haven't actually got any in the chat. So if you can, if you've got any questions and you'd like to have them answered, please add them to the chat. If not, I'm probably going to go through the frequently asked questions that we've got and just bounce those around off Ellie and Sharon. Let's have a look. So we should go back over the. I think Ellie, do you mind doing that?
Sorry, say again. I don't know if my internet's playing up.
I think it's possibly Lewis's.
Opening times and when people can access it, we'll go over that.
And now Lewis is gone. Well, we can answer a couple of. Oh, I can't hear. Your internet's going funny, Lois. Now.
Can you hear me now?
Yes,
It's a bit better. Yeah.
Okay. So I was just asking about, do you want to go over about opening times and who should use the form, what age they should be?
Yeah, so the form will be open from 6 a.m. till 5 p.m. on Monday to Thursday, and it will be open from 6 a.m. till 4 p.m. on a Friday. Everyone over the age of 16 can use the form. Under 16s will still need to phone the practice, and the receptionist will go through some more questions with you, and they will then be booked through the triage system internally by the GPs for the moment, but we're hoping that the under 16s will come online ASAP for the questionnaires.
And then one of the common questions is going to be, what happens if when I go through the form and I submit and it's going to say there's no appointments approved to me, what happens to my request then? Did you get that?
No.
It's going really well, I think, the Facebook Live. So internet, great. So I was asking, can you hear me now, Ellie? Put a thumbs up.
Yes, I think so, yeah.
Good. So I was asking, if I go through all that process and there's no appointments available for me to book on the screen, what happens to my request?
So the request will then be forwarded to our GP triage team to be reviewed, and most of those will be reviewed each day, and you'll be contacted directly with the practice with further advice with regards to what to do, which ideally should be an appointment within the practice at a certain day and time. And it may be that either there's no appointments available to book directly, or it may be that there's another reason that the system has determined that you should have another set of clinical eyes on the form.
Brilliant, thank you. So when does it launch? I don't think we've actually said that. Sharon?
Next Wednesday, 23rd of October. I think I had it on one of the slides, but maybe I didn't. Yeah, next Wednesday.
Next Wednesday, and we access via the website on that link across the top. That will change. And what do I do, Sharon, if I want to book a not a GP appointment? How do I contact to book a nurse appointment? What would I do?
So you can still ring up and book for a nurse appointment on the phone as you would traditionally. Correct me if I'm wrong, but I think you can in some way request across the website for a smear appointment or
Yes.
a vaccination appointment.
Yeah, so we're soon going to put that live as some links on the website so that actually certain specific types of nursing appointments will be able to book, and it gives you the option to go through and book after some eligibility questions on that. And we hope that will expand in time. We also hope that the under 16s will very soon be included in the online form submissions and be able to do that. But it would always, under 16, would always result in a GP having to review it first. You wouldn't be able to auto book an appointment online. So another question, what about follow-up appointments, Ellie?
So follow-ups with our GP team will be arranged directly by them, so you don't need to request follow-up appointments through Rapid Health. If you've seen a GP about something, they should be following you up if that's appropriate. If it's sometime down the line and you want to speak to a GP again about a condition that you may have spoken about months ago, for example, you can still put that in through the Rapid Health triage questionnaire with your symptoms, and that will be hopefully booked with whoever you saw before if possible.
Great.
I think it's probably also worth mentioning when they can actually choose a clinician, can't they? You would have a range of appointments.
Yeah.
You'd be able to perhaps select from that range of appointments a clinician that you would prefer to see.
Yeah.
So that's a useful feature.
And what happens, because a few people might be a bit reluctant to, especially if they're doing it over the phone, with someone to kind of share what they might perceive as personal information about their condition. And can we provide some reassurance about obviously sharing that information in the team on the phone, filling out the form? Sharon?
Sorry, can you say it again?
Oh, sorry, about the confidentiality about some sharing their medical information with a receptionist and answering questions over the phone. Can we provide some reassurance about how that will be?
All our staff are trained in terms of confidentiality, but if there's the more information you can provide that we can put into the system, we can make sure that you get to the right person with the right level of expertise. But obviously, if you're not happy to answer that question when the receptionist asks you, it might be something quite personal, you don't have to respond, but provide as much information as you feel able, because then we can get you sort of dealt with quicker and to the most appropriate clinician to deal with your problem.
And then there's also that people might have certain accessibility needs, like interpreter, or they're profoundly deaf, or any kind of need. How will that be managed, Ellie?
So if people are having problems with the form, it may be that some people find this way of booking an appointment is actually more accessible, because it may be easier to fill the forms in than actually be in the queue for the telephone, for example. But if there are issues with accessing the form or being unable to understand the form, then our receptionists are happy to work through it with you. So I would say contact the practice.
Yes, it's worth saying we can provide the better for us system to analyse, but also for us at the other end, the information helps to guide you to the best appointment possible. But if someone needed interpreter services, they then should maybe contact the practice to phone to the medical appointment, or someone on their behalf. But will Rapid Health consider my existing medical conditions? Does it know what's in my record?
So Rapid Health in itself doesn't know your medical history, but as you could see from some of the questions that were asked, it does ask you for relevant medical history. So please fill that in, because that's what allows the system to pick the urgency. Obviously, when you see a clinician or speak to a clinician, they have access to your full medical record, so we'll be able to review any past medical history, but it doesn't access your record in that way.
And then if I've got multiple things that I would like to contact about from different medical conditions, Sharon, what would be the best thing to do? Do I put it all in one form, or how should I do it?
The best thing to do is actually submit more than one Rapid Health query, because some of our we have time constraints on appointments, and if we're going to deal with your problem adequately, it might be that it has to be done across a couple of appointments.
That's good, thank you. And I'm still encouraging the 6 people that are watching to ask a question in the chat. Be brave, be brave. Yeah, it won't bite. Let's have a look. What else is there?
Is it worth mentioning about filling in for family members? Because that was a query last time, wasn't it? What happens can I fill the form in for a family member? And we said ideally, people should be filling in the form themselves, but if you want to help your mum, dad, cousin, whoever fill the form in, that's fine, but it's likely that you're going to need to be able to ask them some information and obviously have their consent to fill the form in. But as you can see, the questions are quite detailed, so you're likely to need to ask them some of those questions, but you can physically do the form as long as you have the details of the patient.
Yeah, it's good, excellent. What about if with the practice, sometimes the system automatically says the practice will contact you within 2 working days. Can we provide some reassurance on that, Ellie?
So the aim is that the triage box coming into the practice will be aimed to be cleared each day. Obviously, that is dependent on the amount that comes into there, but please be reassured if your condition is urgent, which the system will determine and is easy for us to determine, you will be contacted within within that working day to be booked in or advised elsewhere.
Okay, that's good. And probably worth sharing that you can use the system on a mobile phone, a tablet, anything that can access the internet. so it can be used in different forms. So it's quite accessible in that way. And we are hoping in the near future it will actually become within the NHS app for you to, if you're a patient, you'll be able to access it through there in the future. That's coming. What about how do people find out about test results? Someone asked about results before. How would that be handled through here?
Who are you asking me?
Yeah.
So, or whoever. Yeah. So the most accessible way to access your test results is already through the NHS app, and we wouldn't suggest that you change it. From that, there is a test results function within the admin requests, but that won't give you direct access to the results. It would mean that someone would have to access those and send them to you, and the easiest way is through the NHS app, I would say.
And also for people who may be helping relatives or people themselves who might require home visits, Sharon, how should they contact us?
I think probably the best way is to do what they do already, which is actually to ring the practice directly.
Yeah, that's good. And it's not just before, it's ideally earlier on in the morning, isn't it?
Yeah, I mean, if you can ring us ideally before sort of 10 a.m. in the morning, that does make it a lot easier for when we're allocating out the visits to our GPs and paramedics. And hopefully now that when this system goes live, it should be a lot easier to get through on the telephone.
Okay. And in terms of people who might feel a bit worried or about filling out the form, to sort of have a go, we'll try and produce some how-to videos over the coming weeks on our website, if people can get to the website and literate IT and all that kind of stuff. We encourage as many people as possible who can to maybe do an Amazon drop or something like that. That this form they should be able to fill out and once you filled it out a few times, you do get used to it. Because the more people that fill it out online, frees up the phone lines for those people who cannot access online, which makes their call a bit shorter. We are increasing putting some extra locums before and after the change to be able to maximise our capacities. It's a new thing for everybody. We want to make sure we can try and make the changes as smooth as possible. And also we'll be we're asking some additional telephone support. So we've got more people answering the phones, especially for the first 6 weeks and maybe further on if needed, until everyone's familiar and used to using the system. Is there any other things that we should be talking about, raising? Ellie, Sharon, what can you think of?
Just to say that the appointments are put on 4 weeks in advance, because I think that question came up in the last Facebook Live that we did.
Also,
sorry, you go. And I was just going to say, I think the last Facebook Live raised concerns about the fact that, normally we kind of close our doors and send people elsewhere, and how are we going to prevent that from happening again. The aim with this system is that because a lot of the patients are auto booked, the spread of appointments will be spread more fairly, that doesn't make sense, but fairer, and also allocated in a slightly better fashion. Because what we've been doing at the moment is, because we've got a lack of routine appointments, a lot of stuff is being forced into on the day appointments, which just doesn't work. So the aim is that if the spread is better, patients will get into the right appointment slots with the right people. And as Lois said, we have increased the capacity quite significantly over the last 12 months of GPs, although I know it doesn't necessarily feel like that when you're trying to get an appointment, but we're hoping that this will make things better.
About it is it gives patients a choice of the appointment time and the day and who they're going to see, and I think over time that will actually reduce our rates of people that don't come for their appointments or pick up the phone to answer the GP, and hopefully that in itself will free up a few more appointments each month as well.
Exactly, and I think when it's categorised as your appointment, it'll specify the time frame, whether it's, isn't it, like 3 days, 7 days, up to 14 days. And we found that most people, actually over 70% of people who access a GP would quite like an appointment between 3 and 14 days of contacting us. The number of people that actually need a same day appointment is really quite small. So that's why we think in offering and spreading out the capacity this way gives patients greater flexibility and more convenient to them, but also means that the access is greater as a result of us spreading that capacity out. And I think it's worth noting that we will be monitoring this as we launch. So if we find that actually all of our same day appointments are available because everyone's booking in advance, we will then tweak our how the appointments work. So please bear with us. It's a learning, it's a brand new system for our staff and for you. But we really do hope that it will improve access for patients going forward. So we still don't have any questions in the chat, but I'm trying to rack my brains of the different things that we've asked. I think a lot of it tends to be about people being fearful of the only online, and let's just emphasize that it's not just online, but it's over the phone as well. But we're wanting people to, as many people as possible, to access online. And if anyone's just joined us, you can go back and watch this from the beginning. There might be some glitches in internet connectivity, which might be fun to watch as panic, but you can watch that. And also there is a previous video that we did a week ago in an afternoon that has been watched by lots of people, and that's, you can watch that, and there may be different questions answered there that we can't think of right now. But yes, what else can we tell them about the system?
I think people were worried that there were going to be unused appointments. So what happens if you've got unused appointments? And I think, you know, first of all, that's highly unlikely, but rest assured, you know, if we've got appointments that haven't been booked, we have always got people that things that we can book in there, like, you know, we need to ring a patient about a result or something, that, you know, we will use those appointments. They won't be wasted.
Because actually in the background, the GPs, those people who don't fit into the criteria to have an auto book and book their own appointment, either phone or online, they will then fall into for a GP to review, and who will have slots allocated that they then will then book patients into. So don't worry that no slots will go unused. I think we'll be using them, absolutely using them all. I think it's probably worth, if anyone wants any information, on our website there is a frequently asked questions section that you can read. If you've got a relative that doesn't do online, they can go into practice and get a copy of that. We also have a latest patient update that's out. We will be sending out a survey to patients on Friday about the current access system that we use to get your feedback, and we fully anticipate that won't be a very pretty set of results because it has been very difficult for people to get appointments, but we want to measure that now so that we can then communicate with you again in, say, 4 to 6 weeks' time to ask how this system's going. And then we've made our tweaks behind the scenes, but we want to hear from you because there may be things we don't realise are a problem until we've asked you those kind of questions. So if you do receive a survey, please fill it out. We'd love to hear from you. It's really important we get that feedback. And if you do find that actually short of the time before we surveyed you, just mention to a member of the team if there's something that you find that has been difficult, have you had some problems with, and we want to know so that we can fix it if we can. Ellie, come on, you're the expert. What else have we not talked about?
I think we've covered most of the common things. I think most of the stuff that came up last time, to be honest. I think it's just to reinforce that the more people who can use it, obviously the easier it will be for the people who can't use it. So to try and, you know, encourage people to have a go with it and use it as much as possible, and it helps us to kind of free up our clinicians to help the people who need it rather than the people who don't need to be manually triaged. So
then I did remember, actually, people asked last time about their long-term condition reviews. And how will that process change?
So they'll still remain the same. So, for example, if you need your diabetic review, that will still be booked in via the normal way we book them in at the moment, so via reception or someone contacting you to book those in. So that would stand for asthma, COPD, diabetes.
Yeah, and our recall system, you know, perhaps if you're on a medication that needs regular blood test monitoring, and you've not had your blood test, we will still remind you by the method that we do currently, which is usually a text or a phone call or a letter.
Yeah, that's good. I think we also haven't said that we're not the first people to use the system. So it has actually been around for a number of years, and actually software modality is Surrey using this the first time, and it's gone very well. And our Birmingham practices are using system. So it's something but it's new, it's a new will be learning for us, but we have learned a lot from the other now. Oh, we're back again. Well, we lost connectivity. I'm not sure if we have or not. Were you there?
Yeah, we're here. We couldn't hear that bit, but I think you were just summarising that the East Surrey division and Birmingham division have already gone live with the system and are finding it working very well. Patients are very happy with it. So we're hopeful that that'll be the same here.
Okay, I'm conscious that we've talked a lot, not had any other questions. So shall we wrap up? And here's any last things you want to say?
I think so. I think there's obviously the other one if people want to watch back, and we've got the FAQs, and yeah, I think we've covered most points really, haven't we?
That's great. Sharon?
No, thank you for those that took the time to watch.
Yeah, thank you everybody, and we really appreciate you spending time to come and watch and learn about it. And thank you to everyone who joined the other Facebook Live and YouTube, and also that we had over 700 people attend our face-to-face events, and we really appreciate that because it was really useful and great to meet lots and lots of patients. So thank you for watching this evening, and we will see you at some point, probably again on Facebook Live when we come back to talk about how it's going. All right, good evening. Thanks everybody.
Thanks. Bye-bye.